There we go.
Good, thanks. How are you?
Wait, you wrote
It's last year's and the thank yous.
I didn't know that you followed up.
I did. You were right there with us.
I remember it as soon as I started saying
Okay. It was worse than I anticipated. Yeah, I was sitting there.
You're wearing my favorite color. Oh,
Good to see you.
I know.
and that's why I said cross-legged. I officially started the mess today. Turns out I had sinus infection for lots of months. I just now had to go to the doctor. And I had allergies. Yeah. Unless if I was, you're the one that likes spiders. I'm the one that's scared of spiders.
Oh my God.
You threw a spider at me. I don't mind them in my
It's
just a shape. Also, it's not bothering me because I can't see it.
like you just like stare at everybody else.
Yeah. Yeah, it was a bigger one.
Yeah.
Phone call from Georgia that was repeated the number twice, and it was like, call us before we receive your legal action in your name. And then it was like, thank you and have a blessed day. Okay, you sent in two different messages here. Oh, really? Thank you.
Because when you tell someone have a blessed day, they start to sneeze. We learned nothing.
I want to make that my answer machine.
I got one that said, see you next Tuesday. Thank you, Sven, for leaving me. Rashida doesn't like them. She doesn't like spiders.
I hate spiders, but they're cute for Halloween.
But also, I don't like spiders. I figured this is okay because I can't see it.
That's true. That's true.
I'm
Let's get started. Can I have everyone's attention, please? Hi, welcome to our November Doctoral Student Colloquium. My name is Jamina Williams. I'm the program manager, and we are in like third year now, I believe, of our Doctoral Student Colloquium series. We have some great presentations for you, and so I'm going to hand it over to our moderator, Dr. Michael Haslip. Thank you, everyone.
All right, good afternoon. I am thrilled to be here. Very happy to be moderating this first event in this series of the year, of the academic year. We have two excellent presenters today, and I'm going to really enjoy listening to their presentations. So my name is Michael Haslip. I'm an assistant professor in early childhood education here at Drexel, and I have the pleasure of moderating the session. So let me introduce the program, the format, and then we'll get right to Mikhail and his presentation. So the School of Education is very pleased to be launching the Doctoral Students Research Brief Publication Series that coincides with our Doctoral Student Colloquium Series. The Research Brief is a summary of the students' presentations at the Doctoral Student Colloquium. The Research Brief is a way in which the presenters can disseminate their research information in a concise format with a focused and explicit purpose and with relevance to education. Over this academic year, you will see that the research briefs may include preliminary or pilot studies, research exploration such as literature reviews, works in progress, research issues related to education, or completed research studies. Each month, we will have one EDD and one PhD student presenter presenting their research at the Doctoral Student Colloquium, which is offered both on campus here and online through Zoom. As shared starting this year, each doctoral student presenter will be asked to write a research brief that relates to their presentation and will go into an edited publication. We are so pleased to welcome all of our attendees, both on campus and online, including faculty, staff, students, the university body at large, community members, and partner associations. For today's format, each presenter will be provided with 20 minutes to share his or her research. We will then move on to questions and answers for each presenter. Please save your questions for the end, and at that point, we'll open the floor. There will also be a microphone that will go around for questions from the audience, and if you're online, you can hit the raise your hand button or simply type your questions into the chat bar. So our first presenter is Mikhail Miller. He's a PhD student in the School of Education. I would like to share with you a brief bio, and you can see the title of his presentation right behind me. So Mikhail Miller is a PhD student in the School of Ed with a focus on STEM education. He's particularly interested in mathematics and engineering education. Mikhail is originally from Jamaica, but earned his bachelor's degree from Fisk University in Nashville, Tennessee, in the field of education. He started out as a tutor for mathematics and physics while completing his undergraduate degree. And then he worked also as a substitute teacher at Lead Academy in Nashville, Tennessee. He was also the mathematics lab coordinator and an adjunct math instructor at his alma mater, Fisk University. Mikhail's research interests include reciprocal teaching for math literacy, formal and informal learning, and representation of African American male identities in various levels of education. He's a proud member of Cohort 5, and he's going to be presenting on using technology and collaboration with STEM professionals to enhance students' self-efficacy and interest in STEM. So please welcome Mikhail.
All right, everyone. Thank you very much. I'm a little jittery, I'll admit. Let's go ahead and get that out of the way. But I hope you enjoy the presentation as we go forward. So my presentation is entitled Using Technology in Collaboration with STEM Professionals to Enhance Self-Efficacy and Student and Interest in STEM. So tech has been at the forefront of, just a second. I think we might have opened around. All right, I'll just use this one. Sorry about that. Tech has been at the forefront of education reform for quite some time. And as such, school-based access to technology has been expanding. As a result of this, the way in which technology is being used now is being incorporated into the curriculum of formal and informal learning. Now, as more schools gain access to technology, it's becoming more increasingly important to identify tools, pedagogy, and practices that promote deeper, more authentic learning with technology, particularly in areas where schools have low access to tech. Computer modeling has been identified as one of those tools. It's been shown that computer modeling can be used to help students visualize complex problems and hence move forward in providing solutions to these problems. As an example, after hearing about the death of an infant toddler in a hot car, an 11-year-old African-American student used computer modeling to design a device which would prevent infants from overheating left alone in hot cars. The design has since been patented, and the young student and his parents are currently in communication with car seat manufacturers to see if that technology could be incorporated into their designs. That being said, this is just one example, but I think it demonstrates the idea that students, particularly those from communities that are usually underrepresented in STEM, are interested and capable of learning with technology. That being said, this study is a part of a larger study whose goal is to use emerging technology to enhance upper elementary and middle school students' computational thinking, self-efficacy in STEM, motivation to learn STEM, and consideration of STEM careers. This study specifically is a pilot study that looks at increasing student self-efficacy in computer programming, technology, and science. So for this particular study, we thought about it, or we used these particular theoretical frameworks to guide the study. First off, we use self-efficacy theory. Self-efficacy theory looks at, well, under self-efficacy theory, there's this idea of efficacy expectations. And efficacy expectations is the idea that a person's belief that a specific behavior will lead to specific outcomes. Bandura, who is the grandfather of self-efficacy theory, states that it determines how much effort people will expend and how likely they are to persist in the face of obstacles and aversive experiences. The stronger the perceived efficacy, the more active the effort. Now, the second theoretical framework that was used to guide this study was that of expectancy value theory. Let me just preface by saying there is a slight issue here. This is the wrong slide. So I'm gonna work through it. It's not the updated slide. I apologize in advance. Nevertheless, expectancy value theory, it looks at the value that students place on specific tasks, right? And the idea here is that the value that students place on these tasks, that students put on a subject or a task, is predictive of the likelihood of that student engaging in similar tasks in the future. Now, there is a reason why both these were being used, and the reason for that is they both look at students' beliefs with regards to tasks. However, with self-efficacy theory, the scope is a lot more specific to the task. While for expectancy theory, it looks at questions such as, how well would you expect to do if you had to learn something new about some unspecified topic? While with self-efficacy theory, you must be specific to that topic. Hence, our research questions. Now, for this pilot study, what we looked at was how did the technological tools influence students' efficacy in computer programming? How did these same technological tools influence students' efficacy in science and technology? What themes were related to technological tools? What themes related to technological tools emerged during an intervention during focus groups in Philadelphia? And what STEM disciplines or careers did after-school students mention during the focus groups here in Philadelphia? So one of the things that came up in the literature is that this idea that your environment can impact one's beliefs about one's ability. And we wanted to look also at how the differences in self-efficacy of students in STEM versus in rural versus urban areas. So for the methodology, we had interventions in 2 sites. One in an urban site in Philadelphia, site 2, and another one in a rural site in Wyoming. In both sites, the interventions with their technological tools were field tested, and these tools were Sculptrix, Tinkercad, which are computer modeling programs, for Flight Simulator X, which is a flight simulator program, and drones. Now, in site 1, all the students got the opportunity to use all the tools to their disposal. However, in slide 2, there is a slight difference in how the intervention was implemented. At site 2, only the younger students, so maybe grades 5th, 6th, upper elementary school students got the opportunity to use the modeling programs. They did not, however, get the chance to use the flight simulator programs or the drones, which was fun, I'll admit. The reason for this is because in site 1, teachers reported feeling overwhelmed by having to learn all the new technology and then not having enough time to adequately teach the technology. Continuing, so the teachers received 18 hours of professional development, and the students received 30 hours of intervention time at both sites. This includes both during summer camps and also after school programs. Now, we didn't include the summer camps during this particular reporting, primarily because sample sizes were low. Also, one other thing, only students in the urban settings got to go on the field trips and had the opportunity to hear guest speakers come in and talk to them about STEM careers and opportunities. So I wanted to give you guys a breakdown of what the participants looked like for this study. So at site 1, which was in Wyoming, we had 8 teachers, 94 students, 65% of which were male, 35% were female. For the analytics sample, only 79 students were actually included. This was due to attrition. Some students just did not come back, and some students had missing data. Either didn't turn in all the information that they needed, or for whatever reason, we had some missing data there. In Philadelphia, there were 6 teachers, 64 students, 47% of which were male and 53% were female. The analytic sample for Philadelphia was 42 for the same reasons, attrition and missing data. So I wanted to give you guys a breakdown of the racial makeup of the students involved. There are some students, for the rural sites, there were 75.3% Caucasian, 3% African American, and African American, Asian, and Native American cumulatively. And for Latin students, were 79%. There's some missing data here, and this is because there are students who did not declare a sex on their forms that they needed to turn in, permission forms. In site 2 here in Philadelphia, we had a reverse. We had more minority students. 69.2% were African American, and 11.5% were Latin, and Asian Native Americans are the smallest percentage of 11.5. Not sure why that 0% is. All right, so we use a mixed method approach for collecting this data. Pre and post tests from Kettlehut and Jordan 2018 were used to assess students' efficacy and interest in STEM. Now, this survey essentially measures 5 constructs. We only used 3, and these were for computer programming efficacy, technology efficacy, and science efficacy. A 5-point Likert scale was used to measure computer programming efficacy and technology efficacies, but a 7-point Likert scale was used to measure science efficacy. We had Cronbach alpha measures, which were in the appropriate range for the constructs, and we used paired t-tests to determine if the interventions had significant differences in student self-efficacies. Qualitative data was used to collect interview data at site 2, which was here in Philadelphia, and a constant comparative method was used to find themes in the data. So based on the results, what we saw from the t-test was that for computer programming efficacies, the means increased significantly in both cases, from 3.24 to 3.64 in Site 1, which was a rural area in Wyoming, and 3.31 to 3.48 in Site 2, which was here in Philadelphia. For the science efficacies, what we found was that there was a significant increase at Site 1, a rural area, from 5.26 to 5.57. However, there's a 5.69 to 5.36 decrease at Site 2. This, however, was not significant. For technology efficacy and interest, what we found was that there was a decrease at Site 1 from 3.63 to 3.56, and an increase in Site 2 from 3.56 to 3.59. None of these were significant. So from the focus group interviews, 2 girls, 2 boys were selected from Site 2. And 4 categories essentially emerged from the data. There's technological tools, field trip, STEM as a discipline, and STEM professionals/careers. So what we found was that students at both sites had high interest in the computer programming, and we attributed this to the being introduced to the computer modeling programs, so Tinkercad and Sculptrix. My own observations, these were a huge catch for the students who really enjoyed using these programs. However, for science efficacy, we had an increase at Site 1, which was a rural site in Wyoming, but a decrease in Site 2, which was here in Philadelphia, which was puzzling for us given the fact that here in Philadelphia, the students had the additional benefit of having a guest speaker who was in the STEM field, and also the benefit of a field trip. Well, you know, as the old adage says, I guess sometimes less is more in certain cases. All right. For the next thing, technology efficacy decreased at Site 1, but it increased at Site 2. However, the results were not significant. The qualitative data revealed that students did enjoy the technological tools. And the only negative comment that came from this was the fact that the younger students at Site 1 didn't get a chance to, at Site 2 didn't get a chance to fly the drones. Everybody complained about that. Many of the students stated that they did enjoy hearing from the guest speakers. However, this was not reflected during the science efficacy scores. So they were listening, they did like it, but it didn't impact how they felt about being scientists or being able to do science in that field. And although the presence of the guest speaker didn't appear to influence them, I thought that it was interesting that these students were still able to relate to some of the things that was being said. Now, despite the small sample sizes, the results revealed that students engaged in technology in out-of-school settings hold promise for impacting students' computer programming skills, engagement, and self-efficacy, and interest in STEM. That being said, this is leading us now to the second year of this study, and we'll be looking at the following questions moving forward. For example, what elements of these interventions have the greatest impact on students? How do we refine the interventions to increase positive outcomes? Did gender, race, ethnicity, or local culture play a role in the lower science efficacies? And what factors may have led to an increase in self-efficacy for students at Site 2? And we've come to the end. This is my references. Thank you. Questions?
Thank you, Mikhail. I really enjoyed that. So at this point, we're going to take questions from people online and on campus. Yes, Aurelius?
I have a question. It's about the theory.
Mm-hmm.
You mentioned expected kind of values here at the beginning.
I can't hear you.
You mentioned expected spend value theory, motivation theory at the beginning.
Yes.
The report did nothing on it.
Yeah, in this particular instance, for the expectative value theory is going to be used as the general concept to guide the overall research project. It wasn't particularly used for this pilot, primarily because we wanted to see how the students reacted to the technological tools themselves. Moving forward, there's going to be more of an investigation into how these expectancies are going to come into play with regards to, now that they're familiar with these technological tools, how are they going to respond, knowing that moving forward, they'll be getting the tools on what their learning capabilities moving forward, or what they think about their learning capabilities moving forward.
So one of the things that mentioned efficacy, self-efficacy, research, and expected spend value, two different sets of things, in the sense that for self-efficacy has to do with what someone thinks. Expected spend value theory does not care, but it does not matter what someone thinks about their abilities. As in the case of efficacy, you can do just conflicting theoretical assumptions.
So in a right. So in a paper by Fulton in 2018, I believe, they mentioned having that relationship where both of them essentially are looking from this idea of personal belief from two perspectives. One being more specific, the other one being more general. With the self-efficacy theory, we wanted to use a more specific version here, given that we're just looking at how they're reacting or their beliefs about how they can engage with these technological tools.
So my point is, so where you saw, if we said less is more, perhaps there we need to dig deeper to expect and value theory, maybe that give you a better understanding of what was going on right there.
All right, I'll make a note of that. Thank you.
So I do a lot of gender studies, so I'm really curious in terms of your next steps or what you're doing now. Are you going to be doing any analysis based on sex? And also I'm curious if there's going to be any analysis based on rural versus urban in terms of the two groups.
Yes, there will be analysis based on rural versus urban. I'm not sure if there will be analysis versus gender. It could be something that we look into, but I'm not sure at this point.
Is it just based on the amount that you have in terms of female?
Not necessarily, because I think we have a decent amount to be able to do the particular analysis. It's just not something we've discussed as a research team. So, yeah. All right, I will definitely pass on that message, right?
When you were doing your demographics piece, the sex aspect of it, was that inclusive of the teachers as well, or just
No, that was just the students.
And the teachers do you have data on demographics as well? And how that might impact the students' responses to
yeah, I think we do have data on the teachers' demographics, but we didn't include it for the study. We were just primarily looking at how the students responded to these tools.
So this is going to think it's important to expand how you further define notions of efficacy. Yes. Because it typically is about mastery or perceptions of mastery,
right,
or what you have. And so, in addition to using science in both those things have to do again with engagement. And so, just taking one level assessment of persuasion is not really getting that efficacy. So, I'll spend more time unpacking that piece as you look at. If your team would think about using that term as part of what you do.
All right, thank you. Will do.
Can you go back to your stats page?
We have a question on that.
All right.
Right here.
Which?
So, when you were explaining these, for future reference, you said it decreased from 3 point something to 3 point something. Explain that more qualitatively, because it didn't find significant.
Okay. Will do. This one, if I'm not mistaken. Question online?
Yeah, I have a question online. This is from Emily Cadam. What was the background for choosing Wyoming and Pennsylvania? And sorry if I missed this, but just curious if results would be the same if, for example, all the students were from Pennsylvania, same general geographic region to compare?
So this is an easy question. One of the researchers on the team, well, the principal researchers on this team is a professor at University of Wyoming. And I think there's another professor there as well who's on that team. So we could easily get access to students in that area. All right. Well, thank you very much. Thanks for listening.
Very good. Thank you, Mikhail.
By the way, for presentation, this is awesome.
Better than things.
That's my pleasure, sure.
All right, so thank you, Eric. And thank you again, Mikhail. Yes, first presentation of the year. That was excellent. Thank you again. So, and also thanks for the important questions. Those are very insightful questions, probing the research methods. Very happy to see that interaction as well. So our second presenter today is Eileen Ratner. Now, Eileen comes to us from New York, where she's currently an assistant professor of nursing at the Long Island University School of Nursing. She graduated with her EDD from Drexel's School of Education with an EDD in Educational Leadership and Management a year ago, fall 2018. She also has a Master's of Science degree in Nursing Education from NYU and an MBA from Hofstra University. She also, from the University of Pennsylvania, received her nursing diploma and is a registered nurse from UPenn. So we're very pleased to see her presenting her work today. Prior to becoming a faculty member at Long Island University in the School of Nursing, she was Director of Academic Clinical Affairs at New York University in the School of Nursing for 11 years. As an administrator, she contributed to strategic planning, technology improvements, compliance with CDC guidelines, HIPAA, and electronic medical records. Then she received her doctorate in educational leadership and management here with a focus on global and international education. In the fall of 2018, as I mentioned, she has a special interest in opioid use and misuse that she'll be presenting today. And she established a substance use and misuse committee in the College of Nursing to facilitate the development and implementation of policies and guidelines for students and faculty. She has published in the Journal of Pediatric Healthcare, and she's also affiliated with the American Nurses Association and the National League for Nursing, and was awarded the Award for Administrative Excellence and the Distinguished Administrator Award at NYU several times. So we're very happy to have her presenting on substance use and misuse among nursing students, a phenomenological study. Thank you.
Hi, thank you for having me today. I'm very excited, nervous also. My study, as you heard, it became important to me because of my job, what I was doing. And when I worked at NYU, which I'm no longer there, as an administrator, my job was working in clinical placements with the students. And over the years, while I was working there, opioid abuse became more prominent. As you all know, it's epidemic proportions, and it kept getting worse and worse. So what happened was the hospitals have been implementing policies in terms of having students get tested. A lot of drug testing going on, not just nursing students, but all students. But it affected my position where I was. I placed over 1,000 students every semester. And the issue was that we had no policies, and my research was on a policy issue, which was substance use. And I did some research, preliminary research, finding that there were not a lot of schools out there that had any policies related to substance use and whether they were doing testing. And if they did have any testing, what they were doing about it. Did they have any documentation as to how they were going to handle the issue? What were the referrals, if they were going to make any referrals? So that's kind of my background and how I got interested in doing this. So clearly, substance use and misuse among nurses and nursing students impacts the delivery of healthcare to patients. And in my research, in researching the issue, there was a lot of gaps in the literature. There was not a lot of current literature. Most of the research on this topic was done in the 80s and 90s. So it was really something that really needed to be addressed. And also there are a lot of inconsistent findings from prior studies. It was found that that there are approximately the population of nurses who do have substance use issues is about the same as the general population, which is about 10%, which is still a huge issue. You want to take someone taking care of you in a hospital setting who has that type of an issue. So that's the background. So the statement of my problem was the issue of substance use and misuse among nursing students is of critical importance in nursing preparation programs because students pose a direct threat not only to patients but also to themselves as well. So the purpose of my phenomenological study investigation was to explore the lived experiences, attitudes, and perceptions of pre-licensure nursing students about substance use and the management of substance use disorders among students while completing the nursing education program. So the questions that I had were related to factors that contribute to substance use disorders, how nursing students seek help, and effective strategies for management. Okay, so these are my research questions, which were posed to students who were currently in nursing school, or the inclusion criteria also included those who were graduated within the last 3 years prior to recruitment of the study. So as you can see, my research questions are here. What do nursing students perceive as factors that contribute to substance use disorders among nursing students? What do lived experiences of nursing students reveal about how nursing students with substance use disorders seek help? And based on these lived experiences of nursing students, what type of strategies are found to be effective in managing substance use among nursing students? So using a gatekeeping theory as well as deterrence theory, those were my theories that I based my study on. And gatekeeping theory is being that the nurse faculty member was the gatekeeper, really the person in power who would prevent the student from being in the clinical unit impaired, or protecting the patient. So that's the nurse faculty member as the gatekeeper. And deterrence theory are the consequences. What would deter students from using substances? So I had 3 literature streams that I discussed in my dissertation, which were demographic and psychosocial factors, legal corollaries, and nursing education, and how they all were interrelated in terms of prevention of substance use amongst nursing students. So the gatekeeper, as a faculty member, recognizing immediately signs and symptoms and removing the student, deterrence theory, and fear of punishment. So that was the relationship there. Okay, so I utilized Moustakis as in terms of my phenomenological framework here, qualitative research, and that was used for uncovering the meaning and the truth of the essence of these students' reflections and what they thought about these issues. And I wanted to gain insight into these lived experiences, nursing student interactions with other people as it relates to the phenomenon of substance use and misuse among nursing students. Okay, so my course got IRB approval. My site selection was that from the National Student Nurses Association. the National Student Nurses Association has 60,000 members, and every school, well, not every school, but most schools of nursing have their own, in every state, have their own Student Nurses Association, which is connected to this National Student Nurses Association. So I was able to connect. Actually, the main location for this organization is in Brooklyn. So it was very nice. This woman who is the executive director allowed me to send out an initial survey to recruit students from this organization. So I was able to survey those students, and I used a purposeful criterion-based sampling method for my study. I sent out the survey to 60,000 students, and I got 535 pre-licensure students responded to the initial survey. Of those 535, 82 agreed to be considered for an interview. And in the end, I wound up with 14 students. Even though I had 82, getting the 82 to actually do would not return calls or, emails, whatever, even though they gave me their information, sure, I'll do it. And in the end, they didn't do it. So I wound up with 14 students. Okay, so I did one-on-one interviews, and I did them via Zoom. I did 10 of them were face-to-face. I was able to see them directly, interacting with them directly. 4 of them could not do it by face-to-face. They didn't want to, or they didn't have the ability to do it. So that was fine. So when I did the interviews online, I didn't anticipate them to be as emotional as they were. They were they were great. They really were very good. The students were very open and very like wanting to tell their stories. So it was a really enlightening experience for me. I got a lot of incredible information, which I was became very educated about substance use among nursing students. So it was very good. So I was able to observe and evaluate nonverbal responses as well. And I had field notes as part of my data collection. Okay, so these were my findings. I had evaluated the transcripts. I did the transcripts myself, listening to them 5 different times. And my themes came out to be mental health related issues, stressors, fears and reservations, stigma, seeking help, and awareness. So I did, as I mentioned, I had 14 interviews, but the students were from 11 states across the country, 9 were female, and 5 were male. So the issues that I found relating to substance use disorders, in terms of exactly what I mean by mental health related issues, we're talking about all these different topics here that were presented more than one time. So we're looking at something like mental health related issues. They talked about depression, anxiety, post-traumatic stress disorder, bipolar, ADHD, abusive relationships, stressors, talking about the intensity of the academic workload, prioritizing school and personal responsibilities, all being reasons why they would might be using substances. Fears and reservations, fearful that they wouldn't come forward, fearful of being kicked out of the program, being responsible for other people's lives, failing out. These are all different ideas and themes that came out of the questions that I had asked them. Stigma, shame and embarrassment, being judged, seeking help. There were 3 different ways they could seek help: peer support, program support, external support, and awareness. Being aware of the resources that were available and what the policies were in the particular program that they were in their School of Nursing. Okay, so this is an example of an excerpt of one of the students. 50% of the participants, that's at least 7 students, had mental health related issues. And this, you can read them. I don't know if I want to read them to you, but this is an excerpt of one of the this was my first interview, and I was just so, this one participant, Zoe, she was just an incredible interviewee. I didn't see her face, but she could tell she was so emotional on the phone. And it was amazing how much she was giving of all the information. There's a big background on her, what happened to her in her life. She told me everything that happened, which I was totally amazed about. And she just had a lot of major issues until finally she got herself back together again. She did have a breakdown in school, and the program that she was in, luckily, they were very good to her, and they were able to help her get help. She did go to the hospital, and then she eventually came back to the program. So it was a good outcome for her. And even though, and I was surprised that she wanted to reveal all this information, but it was really good. I think it was more of a, I don't know what the word is, just really getting it out there. She wanted to help others. She wanted to make it known. This is what's out there. What can you do to help? And most of the students that I interviewed, they really wanted other people to know. They didn't want people to know who they were, but they wanted other people to know what was out there and why they were doing the things that they were doing and how they felt going through the program. A lot of these programs are very short programs. These are, could be an accelerated program in a school of nursing, which could be here. Actually, I think they have one here. Drexel's accelerated program is 12 months. You come in with a bachelor's degree, and then you come out 1 year later, and then you're a registered nurse. And it's an intense, very intense, a lot of work, stressful experience. And other programs are like 15 months or 24 months, but they're fast. And you have to do a lot of clinical rotations. You're working day and night, a lot of exams, and weekends. It's just a really stressful experience. My second one, participant number 2, this was another interesting person. He did a lot of interest. He was the crystal meth person. He did a lot of crystal meth, and he had an incredible life himself, in and out of nursing programs. Finally is getting through the end of the program. Actually, by the time I was interviewing, he was graduating. But he talked about so much stress he had in the program, that he just needed this release. And so he ended up doing that. I mean, that's just what he did. And a lot of if you're interested, a lot of the drugs that I learned about were Adderall, alcohol, marijuana, and crystal meth. The Adderall I was not familiar with. I mean, I'm up there in my years, so I wasn't really familiar with the Adderall, but it was incredible to hear about the Adderall, and I'm sure you're all younger than me, so you probably know more about that today, but it's really something that they're really abusing. And a couple of the students that I interviewed that had told me about their Adderall, you could see they were still doing it because they were like, I mean, so high strung and just, gyrating through the whole interview. I mean, just walking around and just very, very high strung. So, and talking about the effects that it was having on them. Okay, another is fear and reservations. That was linked to student interrelationships with faculty. And what happens is the students are very fearful to talk to faculty. But in my research, some of the research that I found, those students who are able to open up and have faculty members be supportive of them did much better. So, but overall, students are very fearful throughout the program that they're going to be messing up, they're going to fail out of the program, they don't want to tell anybody about what they're doing, they don't want to be open up to any faculty members because they're fearful that something's going to, they're going to get thrown out of the program. And that was, this person here talked about that. And then another one, stigma. Some students felt stigma while they're going through the program. There was one student this student, Rachel, she was doing Adderall. She was a constant Adderall. She was a single, 5 minutes, okay. She was a single parent, and she was seen in the school as acting kind of weird. So that was a really bad feeling that she had throughout the program. And then seeking help. The preference for most students seeking help was through peers or family members. Most students did not want to seek help through the school or the program for the fears that they had. Awareness. Awareness is the last theme that I found. And that was being aware of the different policies in the school, what's available to you for resources. Some schools do have resources available to you and to refer you to. Either they didn't want to go or they didn't have a clue, didn't read the handbook, didn't know what was available to them, didn't know that their policy in their school was not a zero tolerance policy. Some students immediately assumed at zero tolerance that they're going to get thrown out of the program. Okay, and my data analysis, I use a Saldana method of coding to do the constant comparative method and to reduce my data into codes and classifying it into categories and themes and data interpretation. My conclusions were that multiple factors can contribute to the decisions nursing students make with respect to using drugs. Faculty play a key role in whether students decide to begin using and continue using and or misusing drugs during the nursing program. Confidentiality, that was a key issue that in terms of seeking a specific avenue of support throughout the program. Also, there was a lack of knowledge among nursing students regarding available resources. And there are, the other conclusion was that implementation of tools and strategies to manage substance abuse, if made available, could be very effective to help students overcome their issues. And finally, my recommendations are that to identify in a program, identify an administrator or faculty member as a confidential resource that students can go to. Identify those nursing students at risk for developing substance use disorders. Incorporating substance use and misuse discussions within the nursing profession into the undergraduate curriculum, which I've been able to do now that I'm an assistant professor, so I can do that. And develop universal manual describing substance use policies and resources available for help. And future, hopefully I'm going to be doing a follow-up study as soon as I get my bearings and everything else that I'm doing. And that's it.
Thank you, Eileen. So at this
Okay.
point, we'll open it up to questions for 5 or 10 minutes here for Eileen. So questions from online and everyone else. Thank you.
Yes.
So thank you very much for a very interesting presentation. I'm curious if any of your participants talked about using while in residency or while on the hospital floor in the nursing environment, and how you navigate those conversations as someone who is protecting confidentiality, as well as someone who's very familiar with keeping patients safe and kind of the contradiction or the juxtaposition of those two facets as a researcher.
That's a good question, because there were some of them which I thought they must be doing this, but they didn't reveal that. Particularly the one doing the crystal meth. But one of the students who was doing the Adderall, she did tell me that she was doing that, and she was totally high strung and was making a lot of mistakes on the unit. And I had addressed that with her directly in terms of her instructor. Did her instructor, was she aware? And she said, no, they didn't seem to get it. So she was doing that. She eventually graduated. So by the time I interviewed her, she had graduated. She was very open about talking about that, and she did do it while she was in the unit. And some of the research that I did on this particular topic talked about students who did come to the clinical area impaired. I think today more instructors are more aware of that. I mean, the idea is to send them home, and our clinical instructors are informed to send students home if there's any, issues of that sort in the clinical area.
So, a similar kind of question. I was wondering, was there any talk about the profession that these individuals are choosing, and then having access to increased medication that could be abused as a nurse or nursing student? Was there any conversation as far as choosing that profession and having to go to work where there is a large amount of
No, actually, nobody. Students are higher risk of developing substance use disorders, or nurses are at higher risk because of the availability that they do have. Although it's much harder today, but it's still available. It's still out there. But no, the students didn't actually talk about, and none of my questions in the interviews did not specifically focus on that. So, yes.
So you got data from 11 different states, right?
Yes.
Could you say more about urban states, rural, urban?
Yeah, I mean, I have the states that I had are Wisconsin, Nevada, Colorado, Massachusetts, Maryland, Minnesota, New York, Delaware, Pennsylvania, Illinois, Georgia, and I said Colorado, right? I had 2 in Colorado. Yes.
In urban versus rural settings, was there a difference in what you received from your respondents?
No, I didn't know whether or not they were from a very rural area or whether they were in the city. I mean, like the one in Nevada I know that was the University of Nevada. And the one in Pennsylvania, I know it was from the Philadelphia area. One in New York, I know was in Brooklyn. So I probably have a tendency to think they might be more urban, but I don't know that answer now. No. That's something I could definitely follow up on in future study. Yes. Right. I think, and in terms of follow-up for me, in terms of quantitative data, that would certainly be something that I would be focusing on for future research, would be the quantitative data and where it's coming from and the differences in the different areas and what the specific schools in terms of policies are in rural versus urban as well would be very interesting also. Yes. Yes.
Are there any policies regarding random drug testing? You have students working in the medical field. I know with certain positions, if you're an airline pilot or something that would impact the safety of other people, there are policies in place.
Right. Not where I was working, and in most of the in one of the schools, one of the students spoke to me about they did have possible random testing, but overall, I did not see that as something that they were doing in terms for students to be in the clinical area now. And the hospitals weren't doing anything at all for the students. It really was, the onus was on the school to provide that information to the hospital if there was any issues. Because the students would, depending on the school too, some schools only do drug testing once a year. Other schools may be asking them to do drug testing twice a year. Everything is different. There's no consistent policies across the country. There's nothing, it's not consistent.
There's stricter policies for athletes in the professional field for random drug testing.
Right.
People in the medical.
Right. Well, when you go to the hospital, they have different policies as well. And I'm sure they possibly have random drug testing. But again, everything where I was focused was on the schools, and the school, it was just the onus of the school to own it. And the students just went. The hospitals were not checking those results or seeing what they came from the school. Yeah. Yes.
Were any of you, did you have an opportunity to talk to any of the instructors of the students where they would have had the training to be able to identify that these students were having issues?
That's actually, I didn't, and that was one of the limitations of my study. And it would have been really helpful, and it would have been a better study if I was able to speak to faculty, and I did not. And that would have really made it a better study. And hopefully, again, for the next one. I thought about doing it, but it would have gotten really huge, so I didn't do that. Yeah. So, yes.
Eileen, I have a question for you.
Actually, 2 questions.
Yeah.
One was you talked about kind of how you started with this group of like 60,000 people, and then
Yes.
that you ended up with 14. How
Yeah.
difficult it was to get there.
Yeah.
Do you think that the sample was motivated in a particular way to speak with you, right? And like, how do you think that might have affected your result, like your motivation to talk with you? And then the second part was that you also talked about just like, I guess, the emotional, wrenchingness of some of the interviews. And I'm wondering if you anticipated that and if that played into your IRB application.
I did not anticipate that emotional thing, no. And that did not, no, in terms of my own.
No one, given your topic about substance abuse, raising questions with your application about, I guess, the well-being or
No. I did address it in terms of if I did find someone that I noticed would be actively using and also currently in school, that I would have the responsibility to report them. So that was all in my statement that they had to read before, but that was it, really. And in terms of motivation, I didn't mention this, I did have a motivating gift card, and they would all receive a gift card at the end of the study if they would be interested in participating. And that was a motivation for quite a few students. I do think they did. I did, particularly as soon as I started, I could tell they wanted to share the stories with me because they were so big. They were so out there. It was just incredible. I mean, I would come out and think, I was drained. After having the first interview, I was like, wow, I couldn't believe it. I just really, it was draining listening to it. And just, I feel like they did want to share. Yes, that was a motivating factor as well, yes. And some people didn't even, in the end, a couple of them didn't remind me that, you know, how do I get my gift card, you know? Some of them did, but the other ones, well, not all of them did. So I think they were motivated, yes, to tell their stories, absolutely.
Eileen, I have a follow-up question for you. First of all, great job. I see you've had practice now getting this narrowed down to a shorter speech. How did, as an interviewer, can you say a little bit about how you managed your own reactions to what the students were telling you during the interview?
That was really tough. That was really, because there was a lot of questions I wanted to ask, but I wasn't sure whether they would be appropriate or not, because this was the first time I was doing interviews. But I just really just maintained that stable. I've worked with students for a long time. I worked with students for the past 11 years. So I'm kind of familiar with how to actually talk to them. So I felt like I was able to just not react. I did not react to really emotionally or, you know, shock. I did not provide the shock factor, which really was there for me. There was a lot of shock. But I think I was able to stay pretty calm and cool throughout that.
Thank you.
I have a question online.
I have a question online.
From
Okay.
Dr. Kathy Geller.
Okay.
Given the number of students who volunteered to participate in your study, what issues does this raise for schools of nursing and teaching hospitals?
It raises a lot of issues. And that was one of the reasons why I quickly, I created this substance use committee, and I quickly had to make policies in the school because I had to be able to address it when I would be getting positive results back. And I was getting positive results back from students. Some of them were false positives, but there were some positive results, and how to manage that. And I think that there has to be a more of a dissemination of information out there, because I don't think that schools are really being facing the issue. They're not addressing it the way they should be. And that's something I guess would be my responsibility to get that information out there. Hopefully I'll be able to publish my research at some point. But the issue is really, it's big. And for hospitals, the onus is really on the schools. The hospitals are, they have their own issues with nurses who have substance use disorders. And that's something that they address, they do their own drug screens and those kinds of things. But it's a big issue, and I think it needs to be more addressed at another level. So, yes.
As far as your research goes, you said that participants had these kind of emotional moments. As a researcher, what did you do with those emotional moments? And then how, after the research was done, how did you help facilitate whatever was needed for the participant in that space?
Well, basically, when somebody would be going through an emotional moment, I would be like, take your time, there's no rush, and we would just could be quiet for a little while. There would be silence, thinking about what their next thing is that they're going to say, because they were very very, very distraught, thinking about the past and I kind of felt bad about that, bringing up the past, but I felt like they wanted to bring it up. So it was kind of a dilemma there. And in terms of getting through it and my response, I would be thinking, I would always leave it with them if I can help them in any way. What could I do? So I was always offering. That's what I do. job and always is if there's anything I can do to help you. And no one ever reached out again, which I was surprised. I thought I might hear back from some students, but I didn't.
To the point of that, just on your topic, I think some advice in the future would be to have phases of interviews, and that way you could readdress some of that stuff in other spaces and other times. And give
Right.
students an opportunity to come back and kind of unpack that stuff.
Yeah, that's a very good idea. That's excellent. Thank you. Maybe for my next phase, yes, my next research study, yes. Anything else?
All right, so I want to thank our two presenters today, Eileen and Mikhail, for very engaging and important topics that they presented. Thank you again. And thank all of you for attending our first event of the year. This is a monthly series, so please mark your calendars for the first Friday of every month, in which we will be having the Doctoral Student Colloquium series. So the next date will be December 6th. That'll be the first Friday of December, and we hope to see you at that time from noon to 1 on campus and online. So thank you very much for coming today.
Oh, he goes out of it. So the one that was pulled up for mine is the one that I used yesterday.
Oh no!
But that was the wrong one.
That's okay, but you were able to.
Well, I made it work.
You did totally. I
made
great job.
I made it work.
I think we have over one. I think Sherry might have something.